Say the best thing about the class that I took with RESTOR Academy was probably the actual science and medical background that she put into the training modules going in. I felt very prepared with facial anatomy stepping into my live injecting day because I have been a nurse for many decades now, and that is not something, facial anatomy, coming from a pediatric cardiac transplant, I knew the heart in and out, right? I don't know facial anatomy very well. So the fact that I had kind of a refresher course on that, I felt really prepared stepping in and injecting live patients that day. What I've achieved after taking this course with RESTOR Academy was just the opportunity to step my foot into this field. It's not ever anything in nursing school that is offered because while it is a medical, while we are very medical, it is not something that is offered in nursing school, and it's something that I don't think many nurses even know is possible or how to achieve becoming an aesthetic nurse injector at the end of the day. I applied to be a part of the RESTOR Academy program to basically put my foot in the door. So the thing that was holding me back from pulling the trigger on signing up for the RESTOR Academy Botox bootcamp was the sticker. It was expensive. Also, I was very scared that I was going to pay all of this money and go to something that wasn't accredited or didn't have credibility, wasn't reputable. If I was going to pay for it, I wanted it to benefit me with continuing ed. So Dr. Waples was very extensive in the online training that we had to do leading up to the actual hands-on day that we did the injecting. And I felt like there was always kind of like an open door of, even if I didn't hire on afterwards, that she was available to answer any questions that I might have, give me references to other aesthetic practices if I should apply to go there. So I really do feel like it was an intimate relationship that I had with RESTOR and Dr. Waples. The fact that it was a small class size and it was going to be intimate, I wasn't going to be just a number. She knew my name, she knew who I was when I walked through the door, and you had to complete certain steps prior to hands-on injecting. I had to pass courses, I had to pass the exams. So I felt more prepared going into actually injecting live models on that day. So that was really something that made me choose that versus other programs that were offered around the area. What I would tell somebody that is trying to step their foot into aesthetic medicine is you really have to be passionate about this field. This is not a soft landing place for the burnt out ICU nurse that has lived the hospital life in the 16-hour shifts. It is a totally different side of your brain that you're using. So you have to be very passionate about regenerative medicine, anti-aging, wellness, but you also have to really be able to sell it. That's one big thing that I did not think I had in me, is being a salesperson, because again, that's not something in nursing school they teach you at all whatsoever. So you have to be that sociable salesperson, true to your core, because that is a major part of this job.